Counseling Older Adult Clients by Ashley Sharp, April 23rd, 2013. Why focus on this population? They're the fastest growing age group, representing 35 million people in the United States. The baby boomers turned 65 in 2011. The 85 and up age group increased by 38% in the last decade. Older adults are as culturally diverse as any group. It is important for professionals working with seniors to recognize and be respectful of cultural differences, including race, gender, nationality, and religion. The strengths that older adult clients possess are emotional stability, family and community support systems. The majority of older adults are mentally alert and engaged. They possess years of life and work experience. Typically, they use their experience, wisdom, and a positive attitude to successfully navigate life challenges and changes. Elderly, ethnic, and minority group members place high value on religious beliefs. Counseling older adult clients. You must keep in mind that a number of role transitions and losses heighten the vulnerability of the older person. Children leaving, career changes, retirement, death of a spouse, isolation, and institutionalization are just a few of these transitions. A deficit in personal resources and or coping skills may mean a need for counseling services. Certain groups show potential for higher counseling needs. These groups include the sick and disabled, the disadvantaged, minorities, prisoners, substance abusers, homosexuals, and the single or widowed. Issues and challenges while counseling older adult clients. Physical health, sexuality in old age, ageism, mental health, depression and suicide, elder abuse and neglect, substance abuse. Physical health. Common physical impairments for older adults are visual changes, hearing loss, arthritis, sleep disorders, osteoporosis, cardiovascular disease and stroke, diabetes, and cancer. The average person age 65 and up takes 5 medications a day. For counselors, it is critical to work with medical providers to rule out possible physical conditions, medications, or medication interactions contributing to emotional symptoms. Sexuality in old age. Sexual interest and activity continue well into the 80s and 90s for many. Emotional and physical stressors can produce problems in sexual functioning. With age, changes occur in sexual functioning in both men and women. Encourage clients to consult with medical professionals, as many treatments and medications are available to improve sexual functioning in older adults. Ageism. Negative attitudes towards the process of aging or towards older adults. Women are more likely to be viewed negatively. Contributes to low self-esteem. Mental health professionals also can hold these biased. Counselors can help clients come to terms with factors associated with ageism and find social support while working to change negative societal attitudes. Mental health. Cognitive decline is normal and may not be progressive. 5 to 10% of individuals 65 and up have mild to moderate dementia, 15 to 20% at age 75 and up. The mini mental state examination is used to assess cognitive decline. Early detection allows for treatment and advanced planning. Coordinate with client to avoid elder speak, oversimplification, or unnecessary repetition of requests. Allow autonomy when possible. Depression and dementia can occur together. Family. To improve family communication, coping strategies, discuss caregiving, and the power of attorney provisions. Medical professionals. To discuss medications, cognitive and behavioral changes in the client. Depression and suicide. Age does not increase the risk of depression. Rates of depression increase for males with age, but decrease for women. Suicides of those 65 and up represented 19% of all suicides. It is urgent to detect and adequately treat depression in order to reduce suicide. Biological and psychological treatments consist of antidepressants, cognitive behavioral therapy, and interpersonal therapy. Elder abuse and neglect. Over 2 million older Americans are victims of psychological or physical abuse and neglect. Mostly this occurs in the family home. Reduction is our responsibility. By increasing public awareness, incorporating religious and community resources, respite care can be provided to reduce caregiver burnout and increasing social support. Substance abuse. Estimated 17% of adults 65 and up abuse alcohol or prescription medication. Drug interactions may mimic psychological or biological conditions. Approximately 30% start drinking after age 60 due to depression or negative life changes. Onset is related to death of loved one, retirement issues, family conflict, physical health decline, or financial concerns. Early intervention to identify and provide support can reduce elder substance abuse. My perspective when addressing counseling issues with older adults. What we can do is acknowledge older adult strengths, focus on the interests of older adults and what they contribute. Encourage activity. Think of the brain as a muscle that can be exercised to stay in shape. Encourage both mental and physical activity as well as challenging leisure activities. Encourage older adults to put their energies towards their own interests and to find new interests. Facilitate strong networks. Staying in touch with others can keep older adults from feeling isolated. Research has shown that having support networks may improve health. Encourage older adults and their family caregivers to ask questions. Emphasize the importance of understanding information and directions from healthcare providers. Create a shame-free environment where older adults feel free to ask questions and stay informed. When working with older adults, I feel a holistic approach is appropriate. Effective counselors treat older clients with respect. Emphasize their strengths, not weaknesses. Develop independence while diminishing dependence. Encourage decision-making and action-taking. Examine their own bias about aging. Are knowledgeable about legal and ethical issues. Encourage client employment, paid or volunteer. Promote physical health, creative expression, and spirituality. Evaluate the client while considering possible social factors and medication side effects. Incorporate coping interventions to address stage-of-life role transition and possible loss. Utilize clients' support system and encourage involvement in activities with people who bring meaning and support. It's true, older adults are often reluctant to seek help and view counseling with doubt, suspicion, and anxiety. We can work to reduce resistance through collaboration within the client's own social network, family, friends, religious leaders, and/or physician. Group counseling is a great avenue that can neutralize some of the potential problems of traditional one-on-one counseling. Group counseling encourages supportive sharing, and social interactions, which may help those coping with loss of family or work contacts. It also reinforces age-appropriate social roles through the sharing of similar past experiences. Information bibliography. Information for this PowerPoint are taken from books, journals, and web resources.